So this is the second pose of the restorative pose that's really good for females on their holy moon cycle, as well as anyone with a lower back injury. And so I just like to say that about females because I know a lot of women who have had a lot of problems down there in that area because they don't honor it. And if you don't honor it when you are having that time of your month, you will eventually get some kind of issues, most likely. So do honor your body and let it rest. So you get the block, lift your pelvis by pressing with your feet into the floor. So you use your leg strength, okay? So first I want you to just push your feet into the floor to lift, and then bring the block. If you have serious issues, then just do it on the lowest level, right underneath your pelvis. You could also lift it up one level. This is like the medium, which I like to start with. Just kind of let your body get used to being in this position. Walk your shoulder blades on your back and lengthen the back of your neck. Press the back of your head into the floor and your shoulder blades into the floor to get a sort of a lift in your chest and in your heart area. And keep your back engaged as you rest and relax your pelvic area. Now what I like to do, after a minute here, if I can feel good enough to do it, I lengthen my legs out. So, I don't know if you can see that, but then after a while, I like to start really rotating my legs inward by kind of making my toes go pigeon-toed or pointing towards each other a little bit. It sort of really rotates the femur head into the hip socket. It's really good for people with any kind of hip pain because it's very common to walk with your legs slightly outward, which is actually slowly making your femur head come out of your hip socket, which is not good. We want to work our femur heads into our hip socket, and that's an inward rotation of the inner upper thigh. Now, bending my legs again, gently, slowly. As I inhale, I press my feet to lift, and I take the block out. I'm going to bring the block to where it's, see how I turned it? So that the long top is going to go right where along my spine, right at the very bottom of my spine. Press the back of my head into the floor, press my shoulders, rotate my shoulders back towards the floor, back and up, so that I lengthen the side body by lifting my shoulders up. Breathing, softening in my jaw. If there's any pain here, then go back down to the lower level. But if there isn't, then stay here and let your body get adjusted and relax. And then if you would like, again, taking your legs out. And again, I like to keep my feet engaged, my inner thighs rotating inwards to get that inward rotation that really is like turning my femur head so that it fits right into that hip socket there. And that's what we want to do. We want to keep our femur heads in the hip socket. And it does take some work and it can be painful at first. There's a big difference between soreness and pain. I guess it depends. It's all painful. But the pain is what you don't want to feel. The soreness is a good thing at first. I mean, soreness can be very painful though, so it's hard to distinguish, and that's the biggest deal. It's learning the difference between the good pain and the bad pain. Because if you learn that, then you know when to stop and what to do and how to do things. Just go slow and be gentle. If it hurts and you're not sure, then stop and see how it feels when you're out of the pose. If it felt like that maybe was a good stretch, then do it a little more and just be gentle, slow, and loving. Go up, and I like to do this since this is intense. I like to go up and down a couple times by pressing my feet into the floor, lifting, and then going back down, letting my body get used to this adjustment of coming off of it, and then removing the block. And laying here for a minute before you do anything else. Letting your nerves settle. Breathing and maintaining that arch in the lower spine that we're always supposed to have in our spines. Looking at a skeleton is really good to know what your spine is supposed to look like. I mean, like a medical skeleton. And rolling to the side to then push yourself up.